Today's lecture is on Introduction to Medical Assisting. The responsibilities of the medical assistant. There are many. One is labeled as the patient navigator. Depending on where you work, you may hear this term or you may not. But what the patient navigator responsibilities include is helping the patient to do all the things the doctor asked them to do. Say you're at the doctor's office, you've hurt your arm, you're not sure what's going on. So the doctor is now going to send you next door for an x-ray. So as the MA, we're going to tell you what you have to do to go for the x-ray and come back. And so we found out that your arm was fractured. So the physician puts you in a sling and is now going to set up an appointment with an orthopedic surgeon. So we're going to give you all the information you need to get to the orthopedic surgeon to be taken care of. That's patient navigation. Our patient navigator also helps take care of the needs for people who are at home and being taken care of at home. So we are a connection or a contact for family members of people and patients at home for us to help coordinate their care. The duties of a medical assistant are administrative, clinical, and laboratory. Administrative includes front office, registering patients, validating insurance, making sure that it's active and that it's your insurance, making sure your demographics, address, phone number, contact people, emergency contacts are up to date and current. And our clinical duties for an MA include rooming the patient, taking the patient to the room. Think of when you're a patient and what is done to you when you're taken into the exam room. We take your vital signs. We ask you if there are any concerns that you have and why you're there. We make sure that your medication and herbal vitamin lists are up to date. We make sure that all the lab work is there that should have been there, x-rays that are needed. We also assist the physician with examinations, whether it's a routine physical, a new baby visit. We could be helping in the gynecology office. We could be helping in the orthopedic office with placement of a cast or removal of a cast. We could be removing sutures from someone. So the clinical duties of a medical assistant are wide and varied. Now, the laboratory duties of medical assistants, some offices do their own testing and some do not. For those that do their own testing, we will do throat swabs and check for strep. We will check urine for pregnancies. We will check urine for infections or glucose or protein. We will also take a drop of blood from your finger and put it in the glucometer to check for your glucose level. And we can also do that finger stick for a drop of blood to check your prothrombin time level. I tell you that your prothrombin is part of the superglue of your blood, the coagulants in your blood, and we check those levels to make sure that your blood thinners that you're on, if you had a stroke or heart attack, are in good shape and that the levels are within normal readings. We also are a connector to the physician or the practitioners because we give them the information that the patient gave us. So the practitioner has what the patient's telling them and has the information that we've given them and can make a better judgment call on taking care of their patients. Medical assisting organizations. These are professional associations and they set high standards for quality and performance. They define tasks and functions. We call this the scope of practice. And they do provide for networking where you can get to know people in your group. Maybe you can hear about CEUs or job opportunities. And we do have accreditation agencies, those that are overall that look at schools, and those, once the school is accredited, then we have the agencies where you and I will go to take our national board certification exams to become board accredited medical assistants. The American Association of Medical Assistants, the AAMA, is a national association founded in 1956, and it is and continues to be endorsed by the American Medical Association. The purpose of the AAMA was to raise standards of medical assisting to a higher professional level, and it does that, continues to do that. It is the only professional association devoted exclusively to medical assisting profession. That is the only accreditations they give are for medical assistants. Now, the accreditation of programs that teach medical assisting is done through the Medical Assisting Education Review Board, the MAERB. Continuing education is required to maintain your certification with the AAMA. You need to get 60 CEUs over a 5-year period, and you need to put them on your account to make sure that you stay certified. If you do not get the required amount of CEUs within the time limit, then your certification is revoked. The American Medical Technologists began to register medical assistants in the early 1970s, and this provides certifications such as the Registered Medical Assistant and Certified Medical Assistant Specialist. And these benefits in this society are similar to those of the AAMA. The CEU is required for the American Medical Technologists need to be renewed every 3 years. For both of these societies and for the National Health Career Association, NHA, you have to pay yearly membership dues every year. You only pay for the test the amount of times you take it, but each year as a member, you do have to pay the membership fee. Now, the NHA was established as information resource and network for health professionals. You can also be board certified through the NHA as a certified clinical certified medical assistant or as a certified administrative medical assistant. You can also be board certified as a medical biller and coder. The National Center for Competency has no allegiance with any organization or association. The National Association for Health Professionals, the American Medical Certification Association, and the American Registry of Medical Assistants do not offer national board certification exams. They are registries that you can put your name on as a certified medical assistant. People can look up and see if you're there. The Medical Assistant Credentials Certification is an organizational confirmation of qualifications to meet professional standards and establish competencies of a medical assistant. Now, the registered medical assistant does not guarantee competence, but does grant license to practice a chosen profession. And I'm going to correct a couple things here. It does guarantee competence because if you take the test and pass, you're competent, but it does not grant license to practice. It grants certification to practice a chosen profession. Safety and federal regulations include the Occupational Safety and Health Administration. This is OSHA. And this administration was created to make sure that the workplace stays safe and that employees are not exposed to hazards that can be kept out of the way. In other words, wet floors, electric cords across the floor, things hanging out of the ceiling, electrical outlets near water sources. So OSHA keeps track of that. You will notice on the counter in your classroom, in the laboratory, that there is an OSHA safety manual there. The Clinical Laboratory Improvement Amendments of 1988, or the CLIA 88 waivered test. This is your point of care testing amendments that allow us to do those strep tests in the office and the urine pregnancy test in the office. The AAMA credential, the Certified Medical Assistant, again, it is an exam that evaluates mastery of medical assisting competencies received at an accredited school. And you must recertify every 5 years. Again, that's 60 CEUs or 12 a year. Now, AMT credentials are a little different. You're known as a registered medical assistant, and you can go to an accredited school and sit for the board exam. Or if you've been in the profession, I believe it's full-time 3 years or part-time for 5 years, you, upon validation with the employer, of course, you may be allowed to sit for your national board certification exam. CEUs, again, are needed for recertification every 3 years, including knowledge of the Health Insurance Portability and Accountability Act, known as HIPAA. Every year, HIPAA is changed a little bit. Things are updated or they are expanded on to understand, so we need to keep current with HIPAA every year. Why training programs? What do they do for us? A knowledge base in these training programs should include administrative and clinical skills, front office and patient care skills, knowledge of insurance and the reimbursement cycle. So if you're in the registration desk and someone doesn't have their insurance and says, oh, I'll bring it later, you need to understand why we need that insurance information right away, because it's going to take anywhere from 5 to 15 days to process the patient bill and then to get it sent out to the insurance company, and they take 30 to 90 days to pay us back for the services rendered. So we need to have some knowledge of different types of insurance that are out there, private and government, and the reimbursement cycle. And that reimbursement cycle starts when the patient walks in the door until the patient's account balance is at zero. Sometimes this can take 6 months to a year. We need to understand compliance with healthcare rules and regulations like OSHA and HIPAA and the high-tech rule. The exceptional customer service you need to give to everyone is the kind of service you want to be treated with. Practice management, what does that involve? It's not just the boss or the manager, but the practice manager takes care of inventory, makes sure that the waiting room is safe for everyone and clean. The practice manager makes sure that everyone with a license or certification is current and that their CEUs are up to date and that they're following the rules of the practice. All right. And the current patient treatments and education, you need to stay current. You, me, every one of us who take care of patients, no matter what our credentials are, we need to stay current with patient treatments. Is there a new way to do a throat swab? I don't think so. Well, we can hope. Is there new information out on CPR? In my lifetime, CPR has changed twice. So we found new ways to keep that heart going. So we need to stay current in patient treatments and education. Now, what is program accreditation? The U.S. Department of Education recognizes two accreditation bodies. These are the overall big guys. The Commission on Accreditation of Allied Health Education Programs, known as CAHEP, is one of them. And this group works with the Medical Assisting Educational Review Board, or known as MAERB. We call it MERB. And the second accrediting body is the Accrediting Bureau of Health Education Schools. We cannot teach programs and receive federal aid and funding and receive approval from the National Board Certification Societies to teach and certify our medical assistants if we are not first approved by CAHEP and ABHES. Those are the people, and again, this is the U.S. Department of Education. So we have to follow all their rules and make sure everything is in place, including your instructors. Are we current on our credentials? Are we receiving CEUs? Are we going to meetings to make sure that we understand the latest and all the policies that you guys have no clue of? So not just do we need to know what we're talking about when we're teaching you anatomy and physiology or medical terminology or telling you about some type of patient service or customer service nightmares, which I'll share with you at some point. But we have to be current on all the policies and procedures in the profession so that we can give you the right information. You can learn all this information, and then you can sit and become certified and go to work to take care of us when we get older. Work experience. A practicum is required for graduation from an accredited program. So your externship, we call this your externship or your practicum. Once you've completed all the classroom, academic, and didactic learning, and you've completed it and passed with the scores that we set up for you, then we set you and send you off into an externship. Now, the length varies depending on the program. So maybe you're talking to somebody who's going to the ABC XYZ medical assistant school, and their practicum is 150 hours and yours is 240. It's not. But not all schools have the same number, all right? The site preceptors become involved with instruction. So your mentor, the person watching over you, is watching you and evaluating you, and every week they fill out an evaluation form. This is an unpaid experience as part of your education, and it does provide a bridge from academics to the workplace. What is professional development? I'm sure you've heard of it once or twice. And this is all about needing to be prepared on day one for your first job. When you walk into your externship, when you go to the interview for your externship, consider it an interview for a lifelong job. And every day you go to your externship, you are being interviewed and evaluated as a possible employee at the end of your externship. So professional development is continuing to learn and improve, ask questions, learn new things, and understand your job. Additional training or cross-training are other forms of education that lead to job placement. So you all are going to be board-certified medical assistants. And what's going to happen is you're going to learn some phlebotomy and you're going to learn EKG. You won't be board certified in those two areas, but you may want to take a short course to become board certified in one or both of those areas, because this adds to your professional development. It adds to you being multifunctional and not just rooming patients and doing these other things, but we can use you in other areas. So the more you learn, the better, as they say, the better deal you are and the more valuable you are to your employer. What about volunteer programs? It is a rewarding experience, and you do gain experience in a different healthcare profession. It does look good on a resume. We're not talking about volunteering 20 hours a week. maybe 40 hours a week, maybe 4 hours a week, or 4 hours every 2 weeks at a place where you usually wouldn't go. So you want to work in a pediatrician's office, or you want to work in an orthopedic office. But why not volunteer at a rehab center? Something very different, because now it shows that you have an interest in other types of healthcare setting, and it's also gives you more education in different healthcare settings. And it is a pathway to being hired permanently. So we're going to go back a little bit about adding to your skills. It's called a multi-skilled healthcare professional, is a cross-trained team member. So we call you a cross-trained team member or multi-skilled professional because you're not just certified as a medical assistant, maybe you're certified as a professional coder as well, or certified as a phlebotomist. It is cost effective to have people who are certified in more than one area and who can jump in and help in another area of the office at any time. You are in high demand when you are a board certified, well educated employee. It does help to expand your career opportunities. You need to stay in your scope of practice. You cannot walk outside your scope of practice. My favorite example is if somebody is not feeling well and you know that you take herbs for a headache, for a migraine, or whatever, you can't give that information to your patient because that's outside your scope of practice. You're not a licensed practitioner. So you can't share your personal use of things with a patient. All right, stay within your scope of practice. And there's really no single national definition of, this type of thing, but there is a standard of care that must be followed. And the standard of care is giving the best care possible every single time you take care of someone, constantly documenting well, greeting them well, treating them professionally. I always say, you are the patient. How do you want to be taken care of? Networking. Networking is definitely crucial to the success in any career choice, and it builds alliances socially and professionally. Here it says to start networking now. Attend professional association meetings, participate in conferences and workshops. It generates opportunities for employment, and you can work on professional growth. I belong to a couple different societies. I attend these weekly or monthly rather meetings. I'm a professional certified coder, so I go to a certified professional coders meeting once a month, and my students, because of these meetings, have gotten jobs because they become members of the society or the local chapters. I've had 3 students get jobs because of their attendance at these societal meetings. So whether it's medical assistant or anything else in your healthcare choice, here we're talking about medical assistants today. When you join the AMT or the AAMA, go to those chapter meetings every month. Go to the national conferences each year if you can, or go to a lot of them have quarterly. Every 3 months they'll have a regional conference. They offer CEUs, and this is a good way to get your CEUs in as well. So work on professional growth in these ways, but networking is very important. That ends today's lecture, and I will see you next time.